Irritable bowel syndrome is a functional disorder. There is no one test to find IBS. IBS is most importantly featured by having pain, bloating, crampy, gaseous discomfort, usually by definition 3 times in the previous months and at least of a 3-month duration. That's the general idea. And then, of course, it's usually associated with constipation or diarrhea or both. So the classic will be alternating constipation and diarrhea for irritable bowel syndrome with pain. And very importantly, they have to have relief of the pain with a bowel movement. IBS tends to affect women more than men, but I have had patients who are of a male gender. Some patients need some dietary modifications to see if that matters, or laboratory work, or other investigative exams like colonoscopy, where we use a camera to look inside the colon. But if you're very constipated and you're bloated from your constipation, you're probably going to have pain. Do you have IBS? I'm not so sure. So I would address the constipation by way of lots of fluids, fiber, and making sure there are no underlying reasons for the constipation to see if they really improve, because they may just have constipation, not IBS. You have to remember, irritable bowel syndrome is different from inflammatory bowel disease, because in IBD, or inflammatory bowel disease, the lining of the colon is inflamed. It's raw, ulcerated, weeping, bleeding. When you look at the colon of a patient with irritable bowel syndrome, it's completely normal. IBS is a constellation of symptoms, and you put together that story, making sure that there is not organic disease, meaning somebody presents to you with a change in bowel habits, you need to make sure that there's nothing else taking place. So you would never label a 50-year-old who never had IBS and who's a male without really being sure that there's no other process taking place in the colon.